Welcome to Group 3's presentation on the Wang family story. In preparation for the family health nurse's appointment with the Wang family, the nurse reviews the chart notes. She reads, Mr. Ming Richard Wang and Mrs. Jing Sarah Wang, 42 and 40 years old respectively, are a married couple who immigrated to Canada 11 years ago from China.
Settlement was very difficult for them in the beginning as they did not have any friends or relatives. They rented a one-bedroom apartment and fortunately, Mr. Wang was able to find a job as a night meal service courier truck driver after a few months. Meanwhile, Mrs. Wang struggled to find a job. After several months, the couple found a church in their community where they met some close friends. Mr. and Mrs. Wang have two children, Christopher, now 10 years old, in grade 5, and Sienna, 8 years old, in grade 4. Mrs. Wang was a stay-at-home mom until both her children started going to school. With the help of their friends from the church, Mrs. Wang was able to find a full-time job as an administrative assistant. Mrs. Wang currently drops her children off at their school before going to work, and her husband picks them up because she works until 6 in the evening. They do not have an active lifestyle because they spend most of their leisure time watching Chinese movies and television programs. With regards to their children, Mr. and Mrs. Wang were told by their daughter's school teachers that Sienna was quite talkative, fidgety, and impatient. She would frequently interrupt teachers during the class lectures and always had a hard time waiting her turn in line. Often, she would have an outburst of anger if she would have to wait too long for anything. Sienna also had poor grades as she was never able to finish an assignment because her interest would quickly change to something else. Some days, her teachers would also find her quietly staring into space. During one parent-teacher interview, her homeroom teacher suggested to her parents for Sienna to get checked for attention deficit hyperactivity disorder. Sure enough, Mr. and Mrs. Wang went to see their pediatrician and Sienna was clinically diagnosed with ADHD. This stressed Mr. and Mrs. Wang as they had numerous questions about this new disorder and were focused on how to improve her grades as they hoped for Sienna to grow up and be a successful and happy adult. At Christopher's last well-child exam, his measured height was 46 inches tall and his weight was 90 pounds. His pediatrician was concerned that Christopher had gained an excessive amount of weight over the past year. His usual diet consists of sweetened cereal with whole milk and fruit juice for breakfast and a sweetened fruit juice box with cookies or chips for mid-morning snack. During the week, Christopher buys his lunch at school. His favorite menu items are pizza, burger and fries, and tacos. Mrs. Wang states that she started a new job this past year that requires Christopher to attend an after-school program until 6 o'clock in the evening when Mr. Wang can pick him up. He receives a snack there, another box of fruit juice, and more cookies or crackers. Mr. and Mrs. Wang report that he is always hungry. They often stop for his favorite chicken nuggets, fries, and a soda on late evenings when the family is too tired to cook. Christopher likes to play video games and has a computer and television in his room. Mr. Wang complains that he spends more time in his room than playing outside. During his school time, he feels that his friends avoid him and states that he has trouble making new friends. A few weeks ago, Mr. Wang went to his family doctor for his annual physical checkup, which he had missed in previous years. Hyperglycemia is noted on his annual routine laboratory result, prompting further testing. The diagnosis of diabetes mellitus type 2 was established. Mr. Wang says that he has been experiencing symptoms of hyperglycemia such as thirst, frequent excessive urination, and has a random blood glucose value of 11.1 millimoles per liter. Mr. Wang is currently overweight and smokes 1 pack of cigarettes a day. Assessment approach. In the care of this family, it is important to first assess and determine the family's perception of their situation and potential stressors, their expressions of feelings, their cultural values and beliefs, as well as the family's behaviors and coping abilities. Partnership with the nurse in the healthcare team is essential. The impact of having the diagnosis of diabetes is profound in many ways. Mr. Wang and his family must now contend with lifestyle choices that affect the food they eat and the activities they engage in. Furthermore, they face the fear of developing complications of this chronic illness. This chronic illness affects the whole person in the family because it not only affects the patient's physical body, but Mr. Wang's psychosocial aspects of life are also affected. The functional capabilities of Mr. Wang and his family needs to be assessed. Mr. Wang's response to his diagnosis is anxiety and lack of knowledge regarding self-management. The nurse makes some notes to herself. Psychosocial considerations. The psychosocial considerations to be examined in the family are: consider available support from family and friends, identify other pre-existing stressors including the client's financial status and health of the family members, assess their health literacy, assess their thoughts on the responsibility to care for the affected family members, consider the impacts upon their children in the family due to the disease condition, identify family's strengths and weaknesses, respect the family's spiritual or religious beliefs, including support from family and friends. In preparation for the nurse's next family meeting and knowing that Wang family is a nuclear family, the nurse decides to use the family systems theory and the Calgary family assessment approach. The nurse also decides to create visual diagrams, the genogram, and echo map of the current Wang family story and situation. The information gathered from both the genogram and echo map help guide the family plan of care and the selection of nursing intervention strategies. It helps in understanding the key people and relationships affecting the Wang family's life. They provide a snapshot of the family as a whole. Application of family systems theory and the Calgary family assessment model, therapeutic questions, and demonstration of manners to the Wang family. Using the family systems theory and the Calgary family assessment model, the Wang family is viewed as a client as a whole. In the slides to follow, nursing interventions will address each family member and the whole family at the same time. Using both perspectives help the family reach stability by building on their strengths and understanding how the Wang family is an interconnected whole, adapting to the changes due to the diagnosis of type 2 diabetes in Mr. Wang. The family health nurse can then formulate a family care plan with the Wang family to help maintain the stability of family's relationship and function. As well, using the Calgary family assessment model, the nurse and the family together can identify the main family problems, concerns, and challenges, and in turn help work together and come up with appropriate nursing interventions to assist the family in coping and adapting effectively. The nurse also prepares some therapeutic questions and reviews some important manners in advance as aid to explore and better understand the current needs of the Wang family as individuals and as a whole. The nurse formulates the following therapeutic questions. Have you faced challenges as a family in the past? If so, what were some things that you think helped you to overcome these difficulties? These questions allow the nurse to identify coping mechanisms during crisis and to see the past and current available resources that are useful to the family during this tough time. What do you fear the most about this situation? What do you expect to see from your illness and from your healthcare team? How does this illness, treatment, circumstances make you feel? What are you most concerned about? These questions gain insight regarding their fears and expectations, which allow the nurse better understand the family's concerns and needs. Is there anything that we have recommended that would be unacceptable or difficult for you? This question will help to identify and explore any differing views and to anticipate challenges that will hinder adherence to the family care plan. What is your understanding of this illness? What questions to you that you would like us to explain further? These questions help to gain insight regarding the gaps in health education, which aids the nurse in identifying the areas to focus on in health teaching. The nurse reviews the following important manners in her mind when interacting with the family to demonstrate manners and establish rapport as a step towards a therapeutic relationship. Always introduce yourself with your name and role. Ask each family member's name and how they would like to be called to avoid depersonalization and be respectful and polite. Practice active listening. Using silence is vital as it allows the family members and the nurse to process what was said and allowing time and space to discuss something further. Another key element of this is accepting and acknowledging what the family member is saying by saying, "Yes, I hear you," or repeating back what you think you have heard in summary form. With this kind behavior, it makes the family member feel that they are being heard and makes them more receptive to care. Nonverbal communication is very important. It is important to maintain eye contact with the person that we are speaking with and making sure we are at the same eye level with a relaxed, non-fidgety composure. This relates to the person that we want to be there and are not in a rush. At the same time, it is important to be mindful of your facial expressions. Thus, do not roll your eyes or grimace. Instead, a soft smile goes a long way and allows the family to open up and feel more welcome. Phones and pagers should be turned off or silenced, especially when taking part in sensitive conversations. But in routine, interaction should be attended to only for urgent matters. Assessment findings. The challenges and difficulties the family may be facing now are: Mr. Wang is experiencing stress and feeling overwhelmed. Caregiving from his family may have initial challenges because of the family's limited understanding of diabetes. The family is at risk of mental stress because of this situation. The family has not been able to provide academic support to Shanna as both parents are working. Christopher is at risk for developing obesity and diabetes because of his eating habits, sedentary lifestyle, and family history. Mrs. Wang is experiencing anxiety and fatigue. She may be at risk for burnout. Commendations of family and individual strengths. A commendation is one intervention that nurses can use to empower patients and families in order to enhance the forming and maintenance of a collaborative relationship. Commendations are statements of special praise that are specific to some aspect of patient and family functioning. The commendations in Wang family's behavior in the midst of their trial are: Mr. Wang's dedication to his family, that despite of his work schedule, he makes effort to fulfill his role in care of his children, such as picking them up from school and dropping them to their after-school activities. Despite the fact that Mr. Wang is mentally and emotionally bothered because of his illness, he thinks of ways to avoid jeopardizing his family's welfare. Though he wants Mrs. Wang to just stay home, he is considerate enough not to take away one of Mrs. Wang's source of happiness, her workplace. Mrs. Wang also shows a sincere willingness to help and support her husband. The Wang family is seeking medical help and support in the midst of the overwhelming health condition. They have a strong religious foundation that they find comfort and peace through their affiliation in a Christian church, where they also have great support from their close friends. And the Wang family acknowledge that they can overcome any difficulties by helping each other and strengthening their relationships. Family Care Plan. After drafting these therapeutic questions and reviewing some vital manners, the nurse writes down some priorities of care for the family as her guideline. The priorities for the Wang family are to establish a family-nurse therapeutic relationship, involve the whole family to the family care plan, and provide effective client and family teaching. A therapeutic relationship is essential in family's health and well-being. It includes trust, respect, genuineness, empathy, responding to family's concerns, effective communication, and information sharing that will assist the family health nurse to understand the family's preferences on environment and treatment care plan, aiding them to trust in the care being provided. The family care plan and nursing interventions with rationales. Family-focused care. After a thorough assessment, the nurse can then determine with the family which areas to focus on. In this case scenario, the following interventions will be explored, not in any particular order: education regarding diabetes, the family's lifestyle, and referral to a registered dietitian; education on treatment and self-management blood sugar monitoring; providing support system and coping enhancement for each family members, including encouragement and support specifics to the family as a whole. Family-focused nursing care for this family involves prevention and reduction of health risks and maintenance of optimal wellness level for all family members. This includes interventions targeting the prevention or reduction of health risks to the family as a whole, such as weight reduction for Christopher and Mr. Wang, healthy eating habits for all members of the family, a more active lifestyle for everyone, Decrease or quit tobacco use for Mr. Wang's own health and to the loved ones around him. Assess Mr. and Mrs. Wang's level of stress and anxiety. Explore Christopher's mental health needs and identify helpful coping mechanisms. Emphasize medication administration and monitoring for Shanna. Develop and implement interventions to decrease disruptive behavior, enhance self-control, and develop social skill. And help the family mobilize available resources. The family health nurse can provide an effective client and family teaching by simplifying diabetes education to meet the learning needs of Mr. Wang and his family, promoting better understanding about the illness and compliance to diabetes management, providing age-appropriate information on diabetes pathophysiology, medication usage, blood glucose monitoring, meal planning, and overall management of diabetes will be helpful for the Wang family. The entire family's learning needs is important. The family may have differing views of the illness and the treatment options, and each may need to be approached differently. Helping Mr. Wang and the family to develop a management plan for their health. The nurse will aim to understand Mr. Wang and the family's self-efficacy and readiness to change. The nurse will collaborate with the family to set goals and plan strategies for meeting them. The nurse will assess the family's perceptions and abilities to make changes, assist them as they agree on what changes they can make together, and explore the family's desires and confidence in their ability to alter lifestyle habits. This can be done more efficiently by holding a family meeting so that the nurse can share information on why changes are needed, the benefits, and risks if no changes are made. Keeping in mind that the nurse will not be simply telling the family what needs to be done, but working together in collaborative fashion, identifying their concerns and helping them identify what they believe will be a plan they are willing to achieve together. By helping the family to develop a management plan, the nurse empowers the family and Mr. Wang to participate in self-care. Family adaptation. The nurse will help the family explore who does what role and responsibilities in the family and how to use the available resources to fill some of the family roles. The nurse will assist the family by discussing the family's strengths, quality time between family members, balancing the illness and family needs, caregiver well-being, economic constraints, identify available community resources, and provide education that builds confidence and skills necessary for the family. Analysis of the Wang family story. Family routines of daily living. Living with diabetes impacts not only Mr. Wang but also his family. Nursing assessment of Mr. Wang is incomplete without considering the way in which his family is affected. The nurse plays a critical role in assessing the level of stress or anxiety the family might be experiencing and taking appropriate interventions to reduce or eliminate the contributing factors. Mr. Wang and his family are stressed because he will require ongoing monitoring for diabetes-related complications, which will mean time of work that the family cannot afford. They will also need a structured meal plan, which is difficult as the Wang family lives to eat from a takeout fast food restaurants due to their busy schedules. Smoking cessation is essential for Mr. Wang, who smokes 1 pack of cigarettes a day. He and his family are also in need of physical exercises, recreational and social activities which help to reduce stress. Family communication. Family communication has been identified as a strength of the couple. Mr. and Mrs. Wang set aside time every day to talk about their day and things on their mind. They have a shared decision-making style. Christopher and Shanna, despite their own challenges, know that their parents love them. They both find time to discuss their issues and concerns to their parents. Family supports and resources. They go to church every Friday for programs and Sundays for worship services and have established a strong network of close friends. This provision of love, caring, sympathy, and other positive feelings from the emotional and instrumental support that their church community offers to the Wang family is very valuable to the well-being of each family. The Wang family is currently fully covered under Mr. Wang's health insurance through his work. Initially, they were worried, but they now realize that Mr. Wang has sick and vacation days that he can take for appointments. Mr. and Mrs. Wang's workplace and manager are very supportive of them as they are known to be hard workers. This family lives a simple lifestyle and are happy with what they have. After looking closely at their finances, they realize that they do not need to both work full-time. As Mrs. Wang really enjoys her work, she decides to take only casual hours to spend more time with her children after school. Shiana is now enrolled in subsidized tutoring services from the government due to her specific case and needs. Family health knowledge. Having just been diagnosed with diabetes, Mr. Wang and his family had decided together to use this time to learn as much as possible so that caring for his diabetes, including testing his blood sugar, going to medical appointments, and taking his medications, now becomes part of the family's daily routine. Mr. Wang and his family are aware that type 2 diabetes can lead to health complications, some of which can be serious. They also understand that there are things that they can do to reduce his risk of developing these health problems. Although their present understanding is limited, their willingness and desire to grow in this area is a strength. Family stress management. Mr. Wang shares that being diagnosed with type 2 diabetes is a frightening and overwhelming experience and has questions about what it developed, what it means for him and his family, the long-term health impact, and how it will affect his everyday life. Mr. Wang is currently working with a nurse and dietitian to address these questions. Mrs. Wang attends all sessions with him as she is now only taking casual hours at work and shares what they learn with the rest of the family. Mr. and Mrs. Wang also express feeling stressed about Christopher and Shiana, and they are working through their current situation with the help of a child psychiatrist. Both children are benefiting from the sessions. Mr. and Mrs. Wang signed up Christopher for weekly swimming lessons, and they are open to seek and learn more available resources to help their children. They are currently seeing a psychiatrist for their stress and anxiety separately and are benefiting from the sessions as well. Family roles. At first, the family struggled to make the needed lifestyle and dietary changes to their family routines. Many of their previous dietary decisions were based on convenience. Changes in the family dietary needs are necessary, and the family is trying to adapt dietary patterns that support Mr. Wang and Christopher's needs. Mr. and Mrs. Wang are learning new things from the diabetes education classes offered at their local community health center that include counting carbohydrates, avoiding processed and with high sugar food, and preparing food in nutritious ways. Mrs. Wang now avoids buying junk food and now shops for more nutritious snack items that will not elevate blood glucose level. The family incorporated the management of Mr. Wang's diabetes into the family routines, and it seems more normal to them now. Christopher and Shanna were unhappy with the dietary changes at first, but they have made a positive adjustment over time. The family makes a point of eating at least one meal together daily, which allows each family member to share about their day. Family culture. The Wang family originated from China with a Christian background. They are of working middle-class socioeconomic status. Family spirituality. The family are active in their Christian faith, they pray and read the Bible daily, and belong to a local church. Wang family evaluation. The family health nurse plans a follow-up call to check with the Wang family. At the next visit, the nurse will review the family care plan with Mr. and Mrs. Wang to see whether their family priorities remain the same or have changed. The nurse plans to observe the family's behavior and interactions to see how they are coping and whether they are adapting well, and assess the stress and anxiety level. Nurse reflection. Mr. and Mrs. Wang have rearranged their lives to manage Mr. Wang's illness and face the continued needs of their children. After the family meeting with the nurse, they recognize Shen and Christopher's developmental needs will continue to influence their choices and actions. In this scenario, the nursing assessments and interventions consider the impact of family's health as it might affect the individuals and the family as a whole. The nurse reflects on her interactions with the Wang family. She determines that her therapeutic communication skills were good. She demonstrated empathy and validated the family's concern and stress for the Wang family individually and as a whole. The interventions were appropriate and empowered the family's overall ability to cope and function as family.